Are you ready to expand your clinical impact beyond patient care? As a physician who scaled a healthcare startup to 9 figures, I'm sharing my proven launch framework in a free masterclass, the Startup Physician's Blueprint. Learn to translate your medical expertise into startup success. Register now at startupphysicians.com. You have to start with a problem that someone will actually pay for. And then you have to start with the problem, not the solution, because you have to be solving a real problem. Because I sometimes see people that are like, wouldn't it be cool if we had something that could do this? And maybe they even make that thing or design that software. And if it's not like really addressing a core problem, it's going to kind of fizzle out. Welcome to Startup Physicians. Please like and follow our show to join our community of physicians who are reimagining healthcare delivery. Hi, everyone. Welcome back to Startup Physicians. This is your host, Dr. Allison Kerfman, and I'm here today with Dr. Dawkins, a dermatologist and founder of Thimble Health. Hey, Manju, thank you so much for joining me today.
Hello. I'm so happy to be here.
So Manju has a very interesting story, and we've interviewed a couple other physician founders on this show, but I would love for you to share with us kind of your journey and how you started Thimble Health, what gave you the idea, what gave you the real actual impetus to go do it instead of think about it, and then what that looked like along the way.
Oh, absolutely. So the impetus, I'll tell you, there was a lag between the impetus and the action. But where it started for me was when I had my first kid. I was a third year in dermatology, and motherhood was a little bit of a shock and disaster. And I thought, oh, health is the only thing I got. So when I took her in for her first pediatrician visit, they're about a month old, kind of a blob. But when she got stuck, it was like she just turned up at me with this very sharp look of how could you let that happen to me? And I felt like, oh boy, I failed. I failed as a mother. I failed as a physician. This was bad. Because, I didn't protect her and I had lost her trust in that moment. And honestly, the pediatrician had lost her trust in that moment, which sounds like very melodramatic, but I actually think there's a lot of truth to it when you kind of expand how many times we all get these injections these days and what does it do to our psyche? Anywho, so that was the beginning of it, but I was a dermatology resident. And so we prescribe EMLA a lot. So EMLA is a prescription numbing cream and it works miraculously. It's hard to use, right? It has all these issues. It's messy. It melts. It's, can cause methemoglobinemia, which can be fatal in infants, but I knew how to use it. And so I ended up trying it out on my daughter and I was like, this is a total game changer. Why isn't everybody else doing it? Well, even we physicians, a lot of us don't even know about it. And it requires a prescription. So there are all these barriers to access. And so ultimately, many years later, it was actually the end of 2016 when I was talking to a friend who's an anesthesiologist and, we were both feeling kind of burnt out in our positions. And I was like, you know what, you need to invent something. And then I basically said the whole idea for Thimble. And so it began.
So what, if you had to say it in a nutshell, what exactly is Thimble and what do you do?
It's basically a comprehensive platform of products to alleviate the pain and stress of needle procedures. And so we treat the pain before, during, after. We treat it really comprehensively, meaning we treat, the physical pain and the emotional and psychological aspects of pain. So really trying to solve the problem of needle aversion.
Well, as a pediatric ER doctor, I definitely deal with that a lot. So I think that, a lot of kids have pretty significant needle anxiety. It can cause a lot of issues with, getting them the appropriate care that they need. But I've seen quite a few adults that really hate needles too. So it sounds like it's beyond just pediatrics.
Exactly. Those kids grow up to be the people who just don't show up to the doctor. They're probably still showing up to the ER because that's you have to at that point, right? But that's exactly the point, is that it's a real reason that people don't get care, right? They don't get the vaccines, blood draws, medications they need, and then they end up basically in an acute situation and it isn't good.
So you had this idea, you told someone in your network or your friend that you were, kind of blah about your current career position and then had this other idea. Well, what happened? Did you just say, you know what, this is a great idea, I'm going to do it? Or what happened?
I did not jump immediately. I asked like 50,000 people around me. I was like, what do you think about this idea? And the moment when I was like, wait a minute, I think this is really something is when I asked, my parents who will tell you the truth, and also my husband. And, he's like, that is potentially the first great idea you've ever had. And I was like, haha, funny. Yes, let's do this together. And so he's co-founder with me actually. But yeah, I mean, that really was it. Like I really did talk to a lot of people because, like as physicians, we look for all the reasons to say no. You know what I mean?
Yeah.
And so, and that was my behavior. And so I really looked at like, wait, why hasn't anyone done this? This is so obvious, right? And so literally that, and at the time I just thought I was like, I don't know, just being in my head. But what it was actually not customer research, but really research, market research. Thank you. Exactly. Like, what are all the solutions that are out there? Why have they not succeeded? Why have they succeeded? What has done well? What hasn't? And it was, we're so lucky to live in the time of Google and all now AI. It's even easier to understand what else is out there. And then it kind of really became clear, like, actually, the reason why people haven't done this before is it's really, really hard. But really, the biggest issue is that people didn't realize how enormous the problem was because the research was really kind of like over here in a corner. And, I don't know about you, but I never got taught anything about needle aversion or needle fear, or let alone ways to make it easier for patients. And, I've talked to a lot of nurses and MAs and phlebotomists over the years, and like, nope, nobody's getting education about this. So we just realized like, wow, this is actually a really big opportunity. But then it was like, okay, great. It's an opportunity. How do we actually do it?
Yeah. Cause you didn't know how to go make a thing. I was joking with you about this before we got on, but it's like people talk about like, oh, I invented a device or created a product. And, with my company, it was creating a clinical model. It was literally like a really big spreadsheet. But you made a thing made out of something. So it's like, how did you go from like, I have an idea to I'm holding like a thing in my hand?
Yes. And yet I did not know how to make anything. Like just to some people, they'll be like, oh yeah, I was always a tinkerer and I used to make, that's not me. I was never that person who was like, I'm going to own a business one day. Like I had no aspirations. I just knew I wanted to be a doctor. So this was all really, really new, which I think is actually, it can be a blessing. That whole beginner's mindset thing I think is real. And so I could be really transparent and honest about it and just say like, I don't know what I'm doing. Can you help me? And so it was a lot of that. And it was a lot of, to get out of my own way and ask people for help. And that feels very uncomfortable. I think, again, as doctors, we're supposed to know the answers to everything, which I actually don't believe is true anymore either. But so it was literally, let's see, I'm trying to think of the first step, drawing it out. That's the first step. And I'm not an artist either, or I was not, but that's the thing is what this whole process has made me realize is like we actually have potential in all of these areas if we just like opened ourselves to it. So anyways, I literally drew a picture of what is now the Prepare patch. And it's crazy because the way it turned out is remarkably similar to that original drawing how many years ago.
Oh, that's so cool.
It's
like
cool.
I have a picture of like this whole like wall of whiteboards that I filled in our very first weeks at the PE firm. And it was like this idea of like what this model could look like. And it's crazy how much of it has been preserved.
Yes. And so it just shows you, wow, there's so much power in just writing things down. Which
yes.
I just thought
get a blank piece of paper. I tell people all the time, get a blank piece of paper, start writing stuff down. Like it wasn't the first time I had thought of this. I had written on a blank piece of paper about the concept like multiple times and thrown them all away, but like, it's still like percolating up here,
Exactly. I'm curious what you think. Do you think that writing it out with your hand has a different power than typing it out on a
Yes. I keep if anyone was if I had it out, I would show you, but I keep these like really big, almost like Post-it notes in my office. And then I frequently will take everything off this desk, and the whole desk is like these giant papers. And I will start, it's like a beautiful mind, like mapping all these things out. So everywhere I've ever worked, that's like an actual organization had a bunch of whiteboards on the walls, and I always was like writing all over them. But I think that it's funny. It helps me process things. It doesn't even, I don't even need, I never look at it again. I map it all out, and then I like stick it somewhere. And then I find it a few months later. I'm like, oh, wow, that's old, but like it's now iterated or whatever. But I feel like it unlocks something in your brain to write it out.
Totally agree. Totally
So
agree.
you drew this patch,
You
and
drew
what
the
is
patch.
it?
And so what is the patch? So for the Prepare patch, it's basically, it's a drug and adhesive patch that contains lidocaine. And the whole idea is like it's specifically designed and formulated for needle procedures. And so I will say I'm going to just stick one on my hand. And I didn't figure out how to do all this beautiful design. I had a product designer who's brilliant, who
Yes.
like, iterates and iterates and iterates and comes up with a thing. But basically what I knew what I wanted it to be was a patch that had basically, we knew exactly how much lidocaine was going to be able to go through the skin. The R&D was all around like, how do we get lidocaine to go through the skin? Which sounds like, duh, that's easy, right? Actually, no, it's not easy. It's easy in on the oral
The
mucosa because
mouth. Yeah.
it's like a sponge. That's part of the digestive tract. It absorbs, but the skin is like an umbrella. It's trying to keep everything out. So we had to figure out how do we get drug to go in, this drug specifically, while maintaining safety. So, and that's another thing. Like even when we started to do the research, we wrote out like, here's what we want. This is for needle procedures. This is this is the time we wanted to do. And it's really cool how close you get to that thing. So anyways, and part of it was, when I use EMLA, I still use it in practice. And, when I was using it with my kids, part of the issue is you lose the intended site. Like people wipe it off because they're like, okay, I'm ready for you. So one of the aspects is this like ring structure, which is like it outlines.
Oh, wow.
Yeah.
That's
So
cool.
yeah, it's simple, but it's very, very helpful for the proceduralist and also for the patient because then you didn't kind of waste a patch. And also another thing is like, this is one of the advantages I think that we have as physicians or anyone who's in the clinic or in the office, in the hospital, like we see what actually happens. And I know what it's like. Like if someone just showed up to something and they were like, inject through this, I'd be like, no, I don't want to get sued. You know what I mean? So we can't really change everything for the doctor or the nurse. And so I didn't want anyone injecting through the patch. It's like nothing changes for the proceduralist. You still wipe with alcohol or chlorhexidine and do the procedure as you always did. So yeah, drawing
So
it.
while it may have taken someone additional on your team who knows how to find materials and put them together and make them beautiful,
Yeah.
you still really needed to know the system of like, no one's going to inject through someone else's, membrane, even if you said it was sterile or something. Like you still knew what some of the systemic issues would be and how you had to design around that.
Exactly. So we get like, I think if you're building something, like use all of your own expertise to inform what you want and then ask for what you want. And those people who know how to do that thing, they come. That's exactly how it happened. Because that was exactly what I thought. I was like, okay, I know what we want, but how do we make this happen? And I'm not saying it was easy to find the people. Like when we had to find, the right research organization to, help us with the formulating, it's work, right? You just have to do the research and I think it is going to be a lot easier with AI these days, but, we just searched for who in the country or out of the country even could do this, made a spreadsheet, compared them, and honestly trusted a lot of our own gut. We just had conversations with everyone and I did write down like, what was my instinct about this? And if I had a bad feeling, I just skipped it.
Did you self-fund the R&D phase?
Yes.
Okay.
Self-funded, which I'm not
That's a leap of faith. That's a huge leap of faith.
It was big. And it was a lot. But I just, if you don't believe in yourself, then who's going to believe in you, I guess. I don't know.
Yeah. Oh my God. Absolutely. How did you feel? Were you scared?
There was
or just
definitely,
excited?
I had a lot of excitement and when I look back at that time, I just knew it was going to be, I was like, this is going to be so easy. Like I remember feeling and saying that out loud, to my parents, especially who were very, very scared and still are. I was like, this is so obvious. This is going to be easy. Once we get this made, it's going to be easy, which, TBD, but I just thought it was so obvious that maybe that kind of that helped the blind faith. You know what I mean? Kind of like, I didn't know all of the hurdles that were going to be there, but that's okay because there are always going to be hurdles. But like, if you let the hurdles just block you, then what's the point? We're not moving anywhere, are we? So
Well, you started with a really good problem too. Like, I think that sometimes I see physicians that want to, okay, one of two things becomes a mistake. Either one, they think of something that would help their patient and they're so passionately wanting to make that specific thing better, but the problem that they're trying to solve doesn't like actually target one financial mechanism. So like it's one thing if like patients would really like something, but if it doesn't affect payers, like the overall cost of care, if it doesn't affect hospitals, and if it's not quite a big enough problem for patients to want to self-pay for it, then it's kind of like, well, you have this like very nice idea of a thing, but like literally who will pay for it?
who will
And
pay for it?
and I could think of like 10 options off the top of my head for you right now. I'm like, heck, my ER would pay for it. Like, um, yeah. And you could absolutely get like larger hospital clients because anyone that does needle procedures, and you could sell it direct to consumer. So I think that, that's the first thing is like, you have to start with a problem that like someone will actually pay for. And then you have to start with the problem, not the solution, because you have to be solving a real problem. Because I sometimes see people that are like, wouldn't it be cool if we had something that could do this? And maybe they even make that thing or design that software. And if it's not like really addressing a core problem, it's going to kind of fizzle out. So I think that you have to start with the right problem and one that like you can sell.
Yes, it's so interesting you say that because, I've done all these accelerators to try to learn because I didn't know anything about business, so needed an education. And that was one of the first things they said was like, solve a problem, don't have a solution, then hack a problem or like find the problem. But I see what actually comes out in the world sometimes is a little bit different. So it's interesting that you say that because sometimes I do see kind of solutions and then they go find the problem to fit. And I do kind of wonder like what happens in the long run. But we shall see. We shall see. And
So you made this patch. So it sounds like you drew it on paper, you had a vision, you self-funded the R&D, you at some point got product designers involved. Did you have like other lines of products? You said you were a platform of products. So
yes.
what's been your process for developing new things? Have you put them on the market? What's been your
Yeah.
approach?
So, when we were kind of ideating and dreaming really about like, okay, what would we want this to be? And we dug into the research, like what would really solve the problem? And it's true that yes, the pain of the stick is kind of the biggest either trigger for people's aversion, or it's pain. Nobody likes pain, so that is kind of the right place to start according to the research. But there are all these other aspects. We knew there was an emotional and psychological part that had to be,
Anxiety.
exactly. And they're commingled. And I even feel like sometimes in healthcare, we don't have a really good understanding of that emotional and psychological part and the importance of treating that aspect. So that was really important to me. And that's why I felt like, okay, we need to get that information out to people. It either needs to be on our website, in an app, in some way that this information has to be a part of it to really solve the problem completely. So I knew I wanted to build the app, but didn't want to allot resources to that yet. So that was kind of on the back burner. Then I also thought we got to treat the pain afterwards because all pain is the teacher that tells us to move away from that stimulus. And this is something that we still don't even talk about in the research very much, but like the pain after a flu shot, or a COVID vaccine or whatever it is going to, trigger something in the brain to say, I'm not doing that again. Like that's why we hear people say like, oh, I got sick from that, so I'm not doing. Anyway, so I think it's important to treat that. But I have also, more, it's funny how life works because like, I think the longer you come along in medicine, you start to realize kind of like how much we don't know in medicine too. And it really, pharmaceuticals are wonderful and surgery is wonderful, but there's all these other modalities of treating that we kind of really dismiss in medicine, like in Western medicine, like the way we go to school and we're trained in residency, we really dismiss a lot of it. So I've always wondered about the value. And one thing that stuck out to me was, I'm a dermatologist, and we talked about arnica. So arnica is a flowering plant that grows in Western Europe. It's been used for many, many hundreds of years in kind of traditional medicine. And it really helps with bruising. So in dermatology, we're very comfortable with talking about arnica. And so I'd always wanted to make this post-procedure patch. And, my family grew up in India, and turmeric is also another, it's like this ubiquitous ingredient that's anti-inflammatory. It's this incredible plant. And it's funny because when I was in between residency and my intern year, I did a year of research, and one of the other scientists was studying turmeric. And anyway, so it's been in the back of my mind for over a decade. And then thought, like, how do we put these together? And it's funny because a roadblock in the manufacturing of Prepare gave me the space to work on Recover, which is the plant-based patch that you put on after that has turmeric and arnica. And so that's another lesson that I feel that I've learned is just like, hey, sometimes the thing that's like, you feel like, oh no, it's all over. Like, how, but it's a blessing that you just can't see yet. And so there was a lot more ease in developing the Recover patch, and it ended up being ready sooner than the Prepare patch. So that came out first, actually.
Wow. And so how did you, how did you know how to make sure this would be safe? Because we're actually talking about, I mean, the lidocaine itself can cause arrhythmias and, dose dependent based on age or weight, or how did you approach that?
That is such a great point. And so a lot of times now that we're telling people about the Prepare patch, they're like, oh, well, there are lidocaine creams out there and there are lidocaine patches out there. And I'm like, yes, nobody knows that they can use them for needle pain yet. But the issue is, does anyone know how to use them and how much to use? And when you're putting a cream on, if I tell you, put 2 grams of that lidocaine cream on your hand, what is that? I'm a dermatologist and I still don't know what that is exactly, right? So, and that's part of why I think the Prepare patch is important. We know exactly how much lidocaine is in this, based on the surface area of the patch and how much goes into it. And so we were very, very conscientious about, like, is this dose safe in case someone misused this patch?
Yeah, put an adult patch on a kid. Yeah, that's what I was wondering.
Yes. And so the quantity that is in this patch is still safe. I don't even want to say it out loud, but if someone
this is quality, this is safety planning, but clearly, so you have adult and pediatric sizes, I'm assuming. Do you
actually we created it so that it would be safe in children. So the way we've dosed it was based on the size of an infant.
Okay.
But the amount and size is still effective and obviously safe for an adult. Because when you think about it, it makes sense, right? A needle procedure, it's just this tiny poke in the center of this thing, theoretically.
Mm-hmm.
You don't need to numb this whole area, right? Actually the size was very intentional. We wanted it to be kind of big enough for an adult so that it would cover 2 veins in the antecubital fossa, for example, but small enough so that an infant could use it. And the other thing that is interesting to think about that people don't realize is, like, all these other lidocaine products out there were developed for a completely different purpose, right? They're all for musculoskeletal pain. And so when you look at the pharmacokinetics of EMLA, it's meant to be left on the skin for 8 to 12 hours too. And so it reaches steady state at 2 to 3 hours and then holds at that. And ours, that's not our goal. Our goal was, like, dump lidocaine in, remove the patch, and then there's no more lidocaine going in. So you get kind of less lidocaine overall. You know what I mean?
How long does it take to work?
30 to 90 minutes. So we want people to have success. So we usually tell people, leave it on for an hour. Then when it's go time, you peel out the center portion and you're ready to go.
Awesome. Well, what do you think are some of the biggest, like, lessons you learned? I mean, it sounds like you've had a really, interesting and pivoting path along the way, and you had to do a lot of things that you frankly just literally did not know how to do. I know every successful founder that I've ever met has a very robust network of people to call on for help. But what tips would you have for physicians out there who maybe have some sort of an idea that they think could be something important?
Yeah, and I think the best part is like we're really good at learning. We humans are good at learning things, and so know that if you could get through medical school, you can do this. And then I said this before, but like being able to ask for help is sometimes a challenge for us, but that is imperative. Like we don't know everything. And in this case, we don't know anything, you know what I mean? And so, but what surprised me was like how willing people are to help. Like people are excited to be a part of something new and they want to help. And they want to feel useful. And so that was, I think, a good lesson for me. And it's okay to not know, and it's okay to sound dumb. I think that was actually if I don't know something now, I'm just like, I have no idea what you're talking about. Can you just spell that out for me real slow?
And you don't sound dumb. You sound like very much like you absolutely know what you do know, and you know your product and you know your vision. But yeah, like there's a whole big world out there. We can't know everything. And I think what you said about people being willing and excited to help is true. Like I think about people I talk to in my network about all sorts of different questions or problems. And I always have someone to call or text about like, oh, there's this weird thing. I wonder who would know about this. And that's what this world is like. Like people are constantly, connecting with each other and trying to solve problems and sharing the problems that they're trying. And I think, growing your network is the number one thing that physicians can do right now, today, whether they're going to found a company or not, whether they're going to become an advisor or not. It's something that literally anyone can do, is to start reaching out and connecting with people.
Yes, the introvert here. So that was really, really big challenge for me. And it's everything. I think that's like a bit of a lie that we were fed, or at least I was, along the way, that like, okay, if you're going to be a doctor, all you need to do is put your head down and study and pass all the tests and do all the things. Networking doesn't matter in medicine. That is a bold-faced lie. Not just, I'm not talking about the startup world. I'm talking about even in medicine. Like your network is your power. And so I agree with you. Like we all need to just get out of ourselves. And we're doing so much better now. I feel like I think physicians are really waking up to this fact. And transparency is important. Like it's okay to talk about salary. It's in fact important to talk about salary. Like that's how we're all going to, get what we all deserve and all of that. So I totally agree. I totally agree. And then also we were talking before about practicing the things that are uncomfortable. And yes, I feel a little bit lucky because a lot of this started happening during the pandemic. And so a lot of the kind of networking was online, which was a lot easier for me as an introvert because I have the safety of a blanket underneath. You know what I mean?
Yeah.
But then, every conversation you're like, oh, that wasn't so bad. Oh, that was, and then you can just keep going further and further out and realize like, wow, there are all these people around me that have this incredible knowledge that I didn't even know existed. Like I didn't know anything about like the process of copywriting or like how design gets done or like how you design a supply chain. Like it's all these crazy things that people know how to do this already, and we can ask for the help.
And honestly, when it comes to networking, I like to like share my story, hear someone's story, and see if there's anything I can do for them.
Yes.
Like that is the core of it is like, are there people that you can provide value to? Because if you just do that, even if you don't have any sort of agenda or anything to sell, or you're not looking for a job or anything, and you're just constantly looking to provide value to other people, it will come back to you 10 times over because, then when you need something, you will have found more and more and more people that, have that expertise. So what would you say is in the future for Thimble Health?
Yes. So there are the products in the pipeline. So we want to, got to do one thing at a time. So I'm trying to stay focused here, but there are other products that we'd like to help for infants and devices and things like that. But one step at a time. I mean, really what our focus is now is, our intention is to change the standard of care for needle procedures. I always say I feel like we have this kind of Stockholm syndrome in a certain way. Like it's always been done like this and we've accepted it and we just think like, well, this is normal. but it doesn't have to be, you know what I mean? We can do better. And just always say, like, it's just like anesthesia. Anesthesia is kind of new. It wasn't here until the 1840s, and now we offer it to everyone. It's not just like the people who are
It would
afraid.
be it would be weird if we didn't.
It would be weird. So the same way, because people are always like, oh yeah, you can give it to the people who are really afraid of needles. I'm like, actually, I think it would be helpful for anyone. Like, human beings don't enjoy pain. And if we want them to repeat a behavior, then we need to start addressing the pain. It's a public health issue. And so what I really hope is that it just becomes more ubiquitous and not such a strange, like, luxury type of thing, and just normal. And I mean, we're sold to the consumer, we're sold direct to consumer, but also to businesses. And, I hope over time that shifts. Like, instead of being more to the consumer, we hear all the time, like, well, why isn't my doctor giving this to me? And we know now that the doctor doesn't have as much control over what gets given to you. And so that's why we have to go for the systems, and hopefully ultimately, something insurance covers, or the insurance company sending to you in the mail, so we'll see.
Yeah. Well, I love your vision. I love how much, dedication you've put towards this. For people that want to reach out, her name is Manju Dawkins. She is on LinkedIn, and we will put her LinkedIn in the show notes, as well as her website. So look up Thimble Health, and we'll put your website in the comments too. So thank you so much for joining me today and sharing your story.
Thank you so much. This has been so much fun.
Thank you for listening to Startup Physicians. Don't forget to like, follow, and share. Are you ready to expand your clinical impact beyond patient care? As a physician who scaled a healthcare startup to 9 figures, I'm sharing my proven launch framework in a free masterclass, the Startup Physicians Blueprint. Learn to translate your medical expertise into startup success. Register now at startupphysicians.com.